The National Hospital Abuja has commenced a 25th anniversary to celebrate our 25 years of professional healthcare service delivery in Nigeria. While unveiling the anniversary logo at the National Hospital premises Abuja, Chief Medical Director of the hospital, Mohammed Raji Mahmood, said the last 25 years has been years of quality services to Nigerians and the hospital have saved millions of lives. He said looking back in history, the hospital has a lot of changes and the hospital has never been static in terms of improvement, while praising the staffs who he said has sacrificed a lot for the nation, from intellectual to time and financial sacrifices. He said that the National Hospital is a hope for the hopeless.
Well, the hospital actually made significant improvements from inception. Like we said, initially it was just a hospital meant for children and women only, but then eventually the expansion of the mandates to involve all other specialties of all ages and all genders meant that the expansion of services have become quite enormous. I don't think there's any hospital that can boast of the numbers of departments that the National Hospital has in this whole country. So also the heavy equipment that the National Hospital has had. And if you follow our trajectory from inception, you will see National Hospital have been the first of so many things. For instance, when you're talking about IVF, National Hospital is the first public hospital in Nigeria to start IVF. When you're talking about cancer care, as at today, National Hospital in the whole of, I would probably say the whole of Africa, but if I want to be conservative, I might just say the whole of the sub-Saharan sub-region. National Hospital is leading in terms of cancer care. When you talk about nuclear medicine, which is an evolving field still, National Hospital has been in the forefront, and we have been training a number of staff in various fields. When you talk about neurosurgery, National Hospital is recognized not only in Nigeria, but in various parts of the world. Here in the hospital, we were able to describe, to modify a certain surgery that has been accepted worldwide and is published in our foremost journal. When you talk about neonatal care, National Hospital has taken a giant stride in that. We have fabricated something we call CPAP for neonates, which is an innovation that wasn't there before. A cheap innovation that has been adapted and adopted in the country and on the continent. Also, we even recently we have managed sextuplets, very, very tiny babies that were given birth to right here, the mother taking care of here. They had their delivery here, and these children grew to a certain comfortable age and size before they were let go. And none of them, all of them left this hospital alive, and they still come to us for their care. So there are so many instances, so many things that I may not be able to enumerate all of them. When you're talking about laparoscopic surgery, we have done some giant strides here. And not only the service that, yes, conjoined twins surgeries that we have done, and not only are the services there and so many, but the fact that we are also training is very, very important. So every single year, National Hospital churns out a number of consultants, that's specialists in medicine. Also, we churn out a number of postgraduate nurses in oncology and in nephrology. Our hospital has been a bane of training for interns in various fields, all the fields, specialties that you talk about in healthcare. National Hospital gives that internship service. So also residency training. When you look at our hospital record management system, electronic management system, that department has been in the forefront in their own field of medical information management. And each time there is a review of ICDs, usually National Hospital is the first to adopt in the country. And when we say in the country, mind you, it's likely to be in the whole of sub-Saharan region. So we are amongst the first also to start digitalizing our records, electronic medical records. Right now we have about the most advanced electronic medical record system. That has increased transparency. It has cut off a lot of corruption and leakages. And because of some of these changes, you could see within a year or so how much of IGR that we have been able to increase. When we started about a year and a half ago, our IGR was roughly about 120, 180, tops 200 million per month. Now we are clocking about 400 plus, nearing 500 million per month. That's just within a span of a couple of months. So, and we are still trying to expand our digitalization process to ensure more accountability, more transparency, and more efficiency. Staff are happier, easier doing their work. But still, that's not without challenges. We have enormous challenges. Most of these challenges have to do with funding. And that's why I'm very, very happy that our former board chair, who has been a father of this hospital, is also crying out on our behalf that really we need that support. Support can come from the federal government, but we must be careful with that because we know federal government cannot take up all the financial burden of the country in terms of health. It cannot, even if it wants to. There are so many competing interests, so many competing needs in the country, from security to food and all whatnot. So that means that some other factors or influencers need to come in, or stakeholders. Part of these are private stakeholders. They can come in as their individual philanthropists to come and improve some of our facilities and enhance some of our services, or they can come in form of PPP to engage us, and then we are open to do PPPs with them in so many other fields. And we also would wish to have international and national collaborators who can come for us to interface and see how best to move this healthcare forward.
Pharmacist Hamza Sakwa, the former board chairman, National Hospital Abuja, in his address called for assistance of well-meaning Nigerians to ensure smooth running of the hospital for the benefit of all Nigerians.
I look very happy, which means there's a good leadership, and public reaction on the national hospital is positive, which means the services are being rendered excellently. So I am glad to associate myself with the national hospital.